I was sort of half awake and half asleep, and I was having a hard time. Obviously, I had had a problem as I'd gotten out of bed, and obviously I fell and I couldn't get back up, and I couldn't understand why I couldn't turn over and push up and get up, and I struggled for a while, and finally I gave up and went over and turned on the light, and my wife awakened with the light on.
I could see that his face was a little drawn, and he could answer me, but he couldn't move his left side. So I'm a nurse, and I knew immediately that he'd had a major stroke.
I ran over here to the house, and he was on the floor by the bed, lying on his left side, and had obviously fallen somehow out of bed and miraculously didn't hit his head or anything. And I said to her, well, we need to call 911 right now. And she said, he won't let me.
And after the second time I said no, she got up and left me and said, I'm going to call EMS. And she did. And of course, I'm grateful that she did.
And I remember I said, I have, my grandfather's on the floor, he's had a stroke. He needs to go to MUSC. I said that directly because we knew that MUSC was the best place for him in Charleston and really anywhere.
Most strokes are really due to a blockage in the head, and he had one down here in the neck and then one further up in the head as well. So when he came in, we took him to our angio suite. We did a procedure called a thrombectomy, where we place a catheter or plastic tube into the vessel over the hip, take other catheters, long plastic tubes to the vessels in the neck, inject dye, and take pictures. That gives us a map of the blood vessels and shows where the blockages are. At that time, we found the 2 blockages. For the one in the neck, we were able to cross that blockage, use a little balloon to help force the vessel open, and then used a stent to keep the vessel open. And then after that, we were able to also see the blockage further downstream. We're able to take bigger catheters, go all the way up to that clot interface or to that blockage, and essentially just aspirate it or suck it out.
I picked up the stroke service the following day, and when Dr. Edwards came out of the intensive care unit, I was his inpatient stroke provider, kind of walking through the different potential causes of stroke in his case and setting up the recommendations for secondary prevention of stroke. And I followed him as an outpatient since that time, monitoring his stroke recovery and his stroke prevention treatment. When patients ask us about symptoms that they should know about that may be stroke-related symptoms, we always tell them to remember the mnemonic FAST. That's F-A-S-T for face, arm, speech, and time. So that refers to any symptoms related to the face in terms of numbness or weakness, any numbness or weakness of the arm, any difficulty with speech, either speaking, slurred speech, or difficulty understanding speech. And then T for time, which is emphasizing the importance of getting to the emergency room as quickly as possible.
My wife said I was totally paralyzed on the left side when I went in. And of course, now I use my left hand to walk without any problem. And it's a God thing as far as I'm concerned. It was such a miracle. The good Lord had a part to play in it, for which I'm grateful. And but I don't want to take all the credit away from my doctors who have worked hard to perfect this technology. And they're obviously getting pretty good at it. And I'm right proud of them and grateful to them for what they've done for me.
My grandfather and I have an unusually close relationship. We've always been very close as a family in general. So dinners with them have become quite the event every night. And I wouldn't trade anything for the days and months that I've been able to share with them here, and for the sweet moments that we've had, especially in light of the stroke.
So if anything good grows out of this, it'll be drawing attention to the need that if you suspect a stroke, go to a stroke center. And we have one at the medical university. There are not that many around the country, but I predict there'll be many more of them developed in the years to come so that we can save a lot of lives.